House healthcare reform bill is poised to take center stage in the Senate, where lawmakers will begin debate of the legislation. Joining us on Newsmax TV is David Patton, senior editor of Newsmax magazine, as well as Dr. Robert Moffitt, a leading expert of healthcare reform.
Dr. Moffitt is the director of the Center for Health Policy Studies at the Heritage Foundation and was a senior official in the Department of Health and Human Services during the Reagan administration. Welcome to Newsmax, Dr. Moffitt.
I'm very happy to be here.
Well, Dr. Moffitt, you've written that the congressional leadership has been trying, quote, every budget gimmick in the book to disguise the true cost of health care reform. What's your reaction to the CBO estimate that the House bill would actually reduce the federal deficit by some $104 billion by 2019?
That's true. Under the House bill, the CBO has measured it. It will, in fact, reduce the deficit. What it does not do is it does not reduce the spending. Remember that the president said at the very beginning of this debate that he wanted to bend the spending curve downward. What this bill will do is add another $1.3 trillion to health care spending. And as far as the deficit is concerned, what actually has happened here is that the House leaders have taken a very expensive portion of this bill that was in the original House bill, the House health care bill, and carved it out. And that's the Medicare payment update for physicians. That was in the original bill, and that would, of course, have added to the deficit. So what they did is they carved that provision out, and next week, what they're going to do is they're going to pass that as a separate piece of legislation. So the way it works is that if you're a company executive and you say to, if you say to the accounting office, look, I'm not going to go over my credit card, and you don't do it, that's fine. But then what you do is you go out and buy another credit card and you run up the cost on that, you run up the deficit on the second credit card. Your first credit card is in balance, but your second credit card is causing an explosion of spending and debt. And the congressional leadership is doing precisely that.
Dr. Moffitt, Congress is notorious for passing supposed Medicare cuts, then later restoring the savings. It's happened 6 times since 2002. Each time this bumps up the federal deficit. Yet Democrats insist this time it's a different story. And the CBO seems to be buying it. Any reason to believe the cuts will stick this time around?
There's no reason to believe that any serious cuts in Medicare will be retained. We have a lot of experience with Medicare, and we have a lot of experience with Medicare over time. The routine story is this. Congress gets a report from the Medicare trustees or from the Congressional Budget Office about very high, unsustainable growth in Medicare cost. And so what do? They go back and they cut reimbursements for doctors and hospitals, home health care agencies, skilled nursing facilities, medical devices, drugs, you name it. They cut them. Then, Act 2, you get a very, very high level of screaming, primarily among physicians groups and doctors and hospitals and various other medical providers, and Congress the following year restores all the cuts. We've been through this as long as I can remember, going all the way back to the Reagan administration. So banking serious healthcare savings on projected cuts in Medicare is folly. There is no grounds for believing that any of these cuts will ever really ultimately materialize. And in the case of the Medicare physician payment update fixes, I mean, there's no reason to believe that that's real.
Now, as far as that doctor fix goes, we've heard that paying more to doctors for the so-called doctor's fix is actually going to increase seniors' premiums an additional $49 billion, and also regular insurance premiums could more than double next year. How does this square with President Obama's promise not to increase taxes one dime on people making less than $250,000?
Well, you can make an argument that increasing seniors' Medicare Part B premiums is not increasing their taxes, but it does mean that they're going to be spending more. They're not going to be spending less, and we're not seeing a bending of the curve. The more serious problem is that the president has repeatedly, at the very beginning of this process, said from day one that the typical American family will experience a $2,500 reduction in typical family health care costs. This is an absurd promise based on the performance of the House and Senate. We are seeing higher health care costs. You're going to have higher health insurance premiums. You're going to have higher taxes. You're going to have higher premiums for Medicare, and you're getting not a bend in the spending curve, but rather a $1.3 trillion explosion in additional spending over the next 10 years. So I don't know what the White House is thinking that we're drinking, but the truth of the matter is none of this is believable.
As these hidden costs gradually hit taxpayers in a down economy, what political consequences do you foresee? Will the backlash cost Obama re-election or perhaps Democrats' control of Congress?
It's very, very hard to say. I mean, so far, as far as talking about what's going to happen a year from now in the election, I think is fanciful. I mean, people can speculate, but one thing we certainly do know, and that is that as this debate has gone on, and American people have had a chance to look at the provisions of the House bill and the Senate bill to the extent to which they were able to see it, people do not like what they are seeing. And right now, there's no major poll that I am aware of, no major survey of public opinion that shows any kind of strong support for this health care bill. There's no consensus in the country. There's no consensus in Congress. The most recent survey research shows that a clear majority of Americans are opposed to what they are doing. What I find remarkable about this entire thing, and frankly, I've never seen anything like this before, is you have Congress acting, knowing that this is true, Congress basically saying to the American people, we've heard you, we're looking at the polls, we know what you think, but we frankly do not care what you think. We're going to give this to you. We're going to impose this on you, whether you like it or not. That will have some consequences, but right now they seem to be taking the position that they really don't care what ordinary Americans think about what they're trying to do to their healthcare system.
Any other budget gimmicks that people should be aware of in the House bill?
Well, the most significant budget gimmick, as I say, is the double credit card, running up the cost on one credit card, keeping the card balanced, but going out and getting another credit card and running up the deficit on the second one, and then saying, see, pointing to the first one, see, we're keeping the credit card in balance. You got to watch them. I mean, very frankly, I hate to say it, but the truth of the matter is that when it comes to fiscal responsibility, members of Congress are simply not trustworthy. They've also said, again, they said they're not going to raise classes on the middle, not going to raise taxes on the middle class. The president said that no American family that makes less than $250,000 a year will see tax increases. Once again, that's nonsense. We're going to see a lot of tax increases. We're going to see increases on premiums. We're going to see tax increases on medical devices and drugs. And frankly, the mandates are, in effect, middle-class tax increases. Mandates on doctors, the mandates on health insurance, the mandates on employers, and then an unprecedented mandate on individuals to buy health insurance or pay a tax penalty. So, you're seeing we're looking at massive tax increases and probably much higher deficits, because when you put it all together, you're talking about a dramatic increase in spending.
We'll have to leave it there. Dr. Robert Moffitt, thanks so much for joining us.
It's a pleasure. Great to be with you.
And thank you for watching Newsmax TV.
Sarah Palin's new book, Going Rogue in American Life, will be released on November 17th. You can be among the first to get your copy. Check out our incredible free offer for Sarah's new book. Just go to Newsmax.com and click on the top banner for this great offer. Act today.